Hi, good evening. Austin Mayor Steve Adler. Got a minute? We're going to try to go through some numbers tonight, and the numbers tonight are not looking good. Visited with County Judge today and Dr. Escott. We continue to talk, but Dr. Escott is concerned, and when he gets concerned, all the rest of us do as well. My staff is trying to let me operate the controls here again tonight, so I apologize in advance if there are glitches, but we're gonna give this a shot. We're going to talk about the numbers we always take a look at, because that's where the concern starts tonight. So let's begin with the key indicators. Let's see if we can share this. I hope you can see this. The new admissions tonight on the left-hand side is at 70. It's been a long time since we reached 70. Remember that going above 50 and sustaining a 7-day moving average above 50 was one of the real tells for us needing to take more serious action with our behaviors. Tonight, the 7-day moving average moves up to 54. We've been bouncing around in the 48 to 50 range. But with 70 new admissions tonight, that's a pretty significant move up to 54. The 70 numbers actually pretty concerning number. When we take a look at what happened during Thanksgiving in the days right up to Thanksgiving, the numbers actually went down for new admissions in the hospital on Thanksgiving because people try to avoid going to the hospital as they're entering a holiday week. You'd rather not be in the hospital on Thanksgiving. You'd rather not be in the hospital on Christmas. So people try not to go to the hospitals, even though if they're sick enough to go, they should go. But we have a number, 70 people that were admitted into the hospital today here just 3 days before Christmas. We were hoping that number would go down, reflecting what we saw in Thanksgiving. Not the case. It's 70. The concern is that 70 might be artificially low, with people trying not to go into the hospital before we get to Christmas. The 54-day moving average is of concern. Number of new cases today, 672. New cases off to the right. That's significantly higher than the 462 7-day moving average. 230 cases, almost 50% more. And remember that as we see new cases, that eventually translates into new admissions. New admissions, as they start going up, eventually translate into greater number in the ICUs. Remember, we only have the ability to really staff 200 ICU beds, and we have to stop the increase in our ICUs with new cases about 2 weeks before we actually see ICU numbers come down, because it's a trailing indicator. So that's why we're concerned, and that's why there's consideration of really elevating the concern to the community. Let's take a look at let's come back out here. We're going to stop sharing the screen, and we're going to try and see if we can get now into the other tab and see if we can share that one. Hope you can see that. The number of people in our hospitals tonight, 349. The 7-day moving average is 326. So we're significantly above the 7-day moving average. That's the census of people in the hospitals. ICU, we have 90 tonight. That is the 7-day moving average. Ventilators, 52, just above the 7-day moving average. So we've been in the ICU range at 90 down to the upper 70s. The concern is that if the new cases translate into new hospitalizations, some of those hospitalizations will need the ICU, and we'll start seeing the ICU number go up. And that's where we have the greatest stress in our system. We're having issues right now in Dallas and Fort Worth with respect to that. And we'll talk about those other cities and positivity here in just a second. Total number of deaths in our community is 525. That's up 3 from yesterday. Austin has one of the lowest mortality rates, certainly of Texas cities, but also cities in the country. And we're going to continue to work following the data and the science, the recommendations of Dr. Escott. But the county judge, Judge Brown, and I are going to continue to work to try to keep that death count as low as we can possibly make that happen. We are so close to a vaccine. We need to hold on. Today is Tuesday. Dr. Escott goes through his slides, and we present a lot of them. They are what you would expect them to be. Rather than go through a lot of slides tonight, I really just want to talk about one. So I'm going to focus on one of Dr. Escott's slides because I think it sums up the kind of concern that is being shared at this point. And this is the positivity in our community. Remember, it wasn't but, a month and a half ago in October, early November, when our positivity rate was relatively low. Not too long ago, we were down below 5, 3.6, 3.3. You can see to the left-hand side there, 3.9, 3.8, 3.9. Then it started going up. Dr. Escott reported that the last full week he has now is up to 9.9. That's almost 10% positivity. That means that at this point, when you head outside and you're around 10 people, there's a decent chance that one of those people is carrying the virus, whether they realize it or not, whether they're symptomatic or not. That's a high positivity to be getting among the universe of people that are being tested. Number might be high because it's selecting for people that had a reason to get tested, but that number is the same number we're comparing to other cities, and that's the concern. The early numbers for next week's positivity number, Dr. Escott is beginning to field those now, and it looks like it's going to be even higher than 9.9. Other cities in Texas, Dallas is like at 18%, about twice what we are, and they're having real difficulties there right now. San Antonio's at 15%, Houston's at 11 to 12%. The state reports our number at 8.5%. So for an apples to apples comparison, everybody's headed up across the state. That's the number that gives us concern. The other concern I think that Dr. Escott was expressing today was that if the experience of Thanksgiving holiday itself repeats itself, we know that despite the recommendation that people try to stay just with their household unit, that with the holiday there are going to be a number of people that meet with people not in their household because it's Christmas. And we would expect the same thing to potentially happen on New Year's, although we're going to try to encourage people not to do that as best we can. But if we have a Thanksgiving-like bump on top of the condition we're in right now, that would be pretty horrible for us. And we have these two holidays, Christmas and New Year's, coming one after the other. This is the really crisis that the experts have been warning about nationally in all our cities. We are such at a tipping point, already stressed, positivity rates high, number of new cases up by 50%. You look at the trends that we're looking at, other information and data. The daily admissions today is 70. The 7-day moving average is 54. That's up 80% over December 1st. New cases today at 672, up above the 7-day moving average of 462. That's a 97% increase since December 1st. The hospital census is 349, 7-day moving average 326. That's up 50% since December 1st. Those are the numbers that have us all concerned. The combination of numbers going up, cases, positivity going up, 2 holidays that we're going to have to try to weather as best we can. We're continuing to meet. We're going to hold a press conference tomorrow morning and talk to the public about really digging in and trying our best to get through these next 2 holidays in a way that will save as many lives as we possibly can. Tomorrow we'll be talking about the risk chart for the community. Remember that we're in stage 4. We've been flirting with stage 5. Stage 5 we need to move into somewhere in the 50 to 90 range. We know that we hit 70 today with a single day total up at 54, 55 as the number that we're at. I want you to know that the city is doing everything it can to also try to keep the numbers down, including increased enforcement. Our enforcement folks are out every night with increased presence on weekends. Our officials go out. They inspect and help businesses comply with the COVID regulations that we have. Most businesses are trying to comply and keep residents safe, and for that we are, all of us, thankful, but there are some bad actors. As of December 12th, which is the last date that I have information and data, the City of Austin enforcement agencies had issued 2 violations of the Austin Code, 43 violations, citations issued by the Fire Marshal's Office. The Austin Police Department had issued 6 citations. We had given out 284 written warnings from the environmental health teams of Austin Public Health, following from 1,654 COVID compliance inspections. They don't issue citations, the environmental health teams, but when they go out alongside other enforcement teams to conduct inspections needed to enforce the COVID orders, they have those folks with them. Citations are given after at least 1, but in many cases multiple warnings. I know that we're now talking to the enforcement staff and suggesting that after a warning, we should start issuing the citations, and if it's egregious and a violation, we should just start issuing the citations. You should know that over 1,000 businesses have been inspected after reports. I've been called into Austin 311 to report possible violations. If you see something that is a violation, please do call it into 311. You know, we have put in these restrictions to try to keep the community safe and to try to save lives. I would urge you not to patronize a bar or a business of any kind that isn't following the practices, is not adequately social distancing, is not requiring masks, is not properly sanitizing the areas. This is a health and safety issue. I mean, you wouldn't eat at a restaurant where you knew the employees didn't wash their hands while preparing the food. And you shouldn't go into a business that's not doing all that it can to keep you and your loved ones safe from the virus. I want to thank all the businesses and all the people that are working so hard to comply. Austin has done really well, certainly as compared to other cities in Texas and most around the country. But we are at a difficult point right now, and with the holidays approaching, we are so close to the vaccine. We have so many people in our community now being vaccinated. the healthcare workers, the frontline people, folks in nursing homes getting vaccinated. We're going to get to the older folks. We're going to get to the people that are susceptible. We're going to get to whoever it is that the health department and Dr. Escott and the state tell us we need to get to. We're going to follow their instructions and roll that out. My hope is that more people than you think are going to be vaccinated by the end of January, and that everybody who wants this gets this by late spring is my hope, and we're going to do everything we can to try to meet that timing. The capacity for the vaccination is growing, which is why on this last really hard holiday crunch, we should be doing everything we can to make sure that as many people with us now are still with us when we can celebrate Christmas and New Year's Eve a year from now, more like we used to. Press conference tomorrow at 10 o'clock. You might want to pay attention to that. People are studying the numbers tonight. And we're going to have to focus to get through the next month. With that said, remember we are all in this together. We all are dependent on one another to keep us safe. We talk about the enforcement action. I want you to know that we were active, but ultimately we can't enforce our way to compliance. It's really what we're willing to do for one another. With that, good night. Tomorrow we'll get together one last time before Christmas to talk about the press conference tomorrow. You all take care, be safe, and good night.